Who is Dr. Nick? So I'm a podiatrist in Akron, Ohio. I have a residency program. We take one resident a year. It's foot and ankle surgery, forefoot surgery, rear foot surgery. About so that's I guess my practice. That's what I do from just day to day. As far as who is Dr. Nick, I kind of started an online presence about 3 years ago that initially started as a way of educating patients. And then it just evolved into, I guess, a large online presence. I never thought that I would have a YouTube channel that has, close to 300,000 subscribers. My Instagram account kind of grew, but my focus of my social media is to educate patients and have it, I guess, build the brand so that when my patients locally find me or come to see me, they already know who I am. I haven't used direct marketing with it. It's just kind of established from there. So I guess what I'm trying to say is I didn't do it to create patients. It kind of happened and it's generated patients to my practice. I would say it's minimally invasive bunion surgery is the largest amount of one particular pathology that I see, but I treat patients with everything. I do general foot care. I see everyday problems, everyday orthopedic problems with the foot and ankle, plantar fasciitis, ingrown toenails, planar warts. And then I also do diabetic Charcot reconstruction. So I see a little bit of everything. So that's a good question. And I think it's a little bit of everyone. The nice thing about it is it provides quick relief. So you'll have patients that come in, they're dealing with plantar fasciitis. Let's just use that as an example. They can't miss work. They can't change their shoe gear. They have to keep continuing on with what they're doing. The pain's bad enough to bring them in, but not bad enough to put them into crutches or a walking boot. And this is an ideal patient to give them something to go home with, to apply topically while they're doing their stretching exercises. I think that's where the pain gel fits in. The arnica, I think, is a great option for patients post-surgically. Inevitably, patients are always asking me, do you have a scar cream? Is there some type of scar cream you can prescribe me? And there's really not a prescription strength scars cream. So the arnica is an ideal agent that has natural healing properties and anti-inflammatory effects. It's safe to use on an incision that's not 100% healed. Healed meaning it's not a wound, but we're not worried about any type of the medium interfering with the incision from healing. And then there's just a lot of patients that don't want to take oral anti-inflammatories. And I think it's nice to have a option for them to use something that's natural. It's inexpensive in terms of when you compare it to some of the prescription topical analgesics, and they're not ingesting it. So I think it has a great role for patients that don't want to take oral anti-inflammatories. Well, it was kind of a simultaneous thing in working with Power Steps. So I use their orthotics in my practice. In terms of orthotics, the literature has kind of pushed our field towards using over-the-counter orthotics because they're, again, less expensive and they can accomplish the same outcome as a custom orthotic in a lot of particular pathologies. And then when I saw that there was another product such as Dr. Hoy's analgesic and creams available, patients are always asking for something like that. And if you're not using a compounding pharmacy, you don't really have any options available for it. So I think that this big driver of it was patients saying, is there anything I can have topically? And I would typically use Voltaren gel, which has become over the counter. And even when prescribing it, it wasn't being covered. They were calling back to the office saying, I can't afford this. It's not covered. Or is there something else? When you're using a compounding pharmacy, those prices can be extremely high. So this just kind of has that niche of being right in the middle. It's over the counter. It's less expensive for the patient, meaning it's more affordable. It would be how I would, I guess, place it or term it. And they're able to see immediate relief in using it. I think something else that's great with the Dr. Hoy's pain relieving gel is it has both camphor and menthol in it, which has that heating and cooling effect respectively. And a lot of the other products out there don't do this. This is where it has its ideal indication, I think, or it stands out from the other over-the-counter analgesics, is it's both heating and cooling. So you kind of get that pumping effect of heating and cooling the surface of the skin and the microvasculature. and there's some physiologic effects from it. That's another great, I don't want to use the term selling point, but it stands out from its competitors in doing something physiologically that they can't accomplish. Most of the times when patients will come in to see me, they've already tried taking anti-inflammatories. Maybe some of them aren't pill takers, so they don't want to take anti-inflammatories because they may have GI issues or they're on anticoagulants and they can't take them. And this is a great patient to try a pain relieving gel, and you can boost it with the arnica cream, which has an anti-inflammatory effect, so it can prolong the analgesic effect that you've received initially by using the pain relieving gel. So you can combine them together to get longer relief. And, let's, as an example, a patient with chronic plantar fasciitis, they might be trying to exercise to lose weight, or they're on an exercise program and they're getting symptoms or pain. You can use the pain relieving gel to start your activity, and it kind of gets them through their activity. So you're providing an instant effect as opposed to taking something that takes hours to kick in. And then, some of my geriatric patients that have severe midfoot arthritis, they're not surgical candidates. Again, they don't want to take medications. They ask for topical analgesics. And this is another option for them to use. It's ideal in those situations because these patients, look, some of them they're unable to walk. They can barely get around with the cane, and they come in with pain to their midfoot, which has severe arthritis. Surgery. They don't want an injection. They can't take anti-inflammatories. This gives them some relief, and it's safe and natural. So they're different, but I try to educate my patient and let them know this is when you would use the analgesic gel or the pain relieving gel. It's more of a menthol that provides a sensation change to the skin, reducing pain. So it's an analgesic, right? The arnica doesn't have any sensory effect. It doesn't change the sensation, but it has an anti-inflammatory effect. So it has a natural anti-inflammatory, a list of ingredients in it, and you can combine that with the analgesia from the pain relieving gel. So you can start the pain relieving gel, get instant pain relief, and then as the arnica is being absorbed into the system topically, when I say system, it's local, so it's not being absorbed systemically, but it's being absorbed locally to provide an anti-inflammatory effect. I do. Anytime someone sees a natural ingredient, I think especially in today's world, they're paying more attention to it. So when you can get a natural ingredient that is actually an anti-inflammatory, now the patient's thinking, well, it's safe if it's natural. Arnica has been around a while, so it's not something that's new. It's just now being implemented in this manner. So we know that it has anti-inflammatory effects. And then you combine that by saying guaranteed. I think the patient's willing to try it. It's a little bit of both. They have the tear-off packets, which are a great way to expose the product to the patient. And those are sometimes sitting in the waiting room where patients will see them and they'll ask me. But my practice isn't really a high volume selling practice with products like this. So for me, this product fits in as I educate the patient and say, hey, this is available. You can buy it here. And then it's tough, right? Because some patients, they want to research it. They don't want to make a split decision. So I tell them, look, it's available on drhoys.com. I am in the process of developing a link from my YouTube site where they could get it there. And then I also use Doximity, which is a great way of communicating with your patients. So I'll be right there in the room and I'll say, look, there's a product you can get if you want to, if they're not interested in buying it today, they can think about it. I use Doximity to actually send them a text message with a link that brings them right to Dr. Hoy's webpage to purchase it if they'd like to. They can get a coupon code through our office. I don't normally do that because I'm just more concerned about putting this in front of the patient so they have an option to get it. And then they don't see my number. So it's a way to communicate with them through an app that allows them to go right to Dr. Hoy's webpage if they want to purchase it. In fact, I just did that today. I was with a patient that had the midfoot arthritis, like I was discussing. They were there with their daughter. The daughter was interested in it. The mom says, I could use this on my back. I said, here, look, there's many options because the conversation just kept going and going. I said, here, you can try Dr. Hoy's. Here's the website. I send it to them immediately. They click on it, and she had already started purchasing it before they left. Oh. Yeah, I have a staff of medical assistants, and we use Link on the computer. So I'll send a link message and say, so-and-so in room 3 is interested in this they need Dr. Hoy's cream, they'll need this. Can you bring it in, or can you have it ready for them on their way out? Or if it's an insert, if we're doing, a power step, I'll say, this is their shoe size, this is what they need. I send a link message to them, and then they come in and talk to the patient. So I don't like to have them sell anything. It's more coming from me. So it seems more of, it's a medical need for it as opposed to a retail situation. It has a great indication for pediatrics. I had a patient today with Sever's disease, which is apophysitis of the calcaneus, or growing pains. She was 9 years old. Her parents don't want her to take anti-inflammatories. Most kids won't swallow pills. They want immediate relief so they can go outside and play. So you have them use the roll-on and roll it on their heel. They have fun in doing it. You teach them to massage the plantar fascia with it. They get an immediate effect, immediate relief. Because really, treating Sever's disease, it is an inflammatory process. There's not a surgical indication. There's not a cure. You can try using inserts or orthotics to reduce the stress to it, but you'll get an immediate pain relief by using the analgesic gel and anti-inflammatory. I have the most unique email out there. It's feet@me.com, feet@me.com. You can send an email there. I do my best to try to respond. You can imagine with this social media, the way it's taken off, I can't keep up with everything when people are reaching out to me on YouTube and Instagram, but I do my best to try to respond to emails. So if you just want to look me up, you can look me up by my name. My handle on YouTube is @FootDoctor. If you just Google me, you can find me. And I love talking. I'm a sucker for conversations. I'm always open to chat. I just think whether you dispense in your office or not, this isn't something to say, oh, I need to start dispensing. I think this is just a great overall tool for your patients to use. And I think once you try it and realize, it's kind of like keeping Tylenol in your purse. When you get a headache, you have your Tylenol. When you have an ache or pain, that's why I said throw it in your golf bag. If you have elbow pain when you're golfing, it's easy to use. I think it's a great tool for your patients, especially in today's age when patients can't get off work. They need something for some relief. They're not going to complain about this. It'll help them, and it's safe.